So welcome. This is our fifth training for the advisory board committee. And it will be our last in the initial series. If you need more training, just let me know what those topics might be that you need training on, and we can try to work on that for you. So today's training is on quality improvement and the consumer role. So we'll start with talking about what quality improvement is, go into some details around research methods and tools. This is a topic that I could talk about for a million years. I actually really love this topic. And also, it's a very complicated topic. You can really go down a lot of rabbit holes. We are not going to do that today. We're going to stay pretty top level. And then we'll end by talking about the consumer role. So the goal of this series is to provide education and support to the advisory board committee. The purpose of the training is to help ABC members learn best practices for participation in committee work. Today's topic is meant to help us understand the quality improvement process and the consumer role. So let's dive in. So when you hear the word improvement, what that means to a lot of people is change, like all capital letters, change. And change can be super scary. And so a lot of times you hear, we've never done that before. Why do we have to change the way we do things? If it's not broke, don't fix it, right? We hear a lot of those kinds of things all the time. So I found these great Dilbert cartoons. I love these Dilbert cartoons. And they kind of really highlight the concerns that come up when we're talking about quality improvement. So this first cartoon on the top is all about how complicated the language around quality improvement topics is. So Dilbert's boss says, Ted, I don't know how to say this. We need to lean up the process improvement process, so I have to smart size one resource. And then Ted says back to him, wow, usually it's just a figure of speech when people say, I don't know how to say this, right? And so hopefully our conversation today will help to simplify things. But what I have found is really helpful when doing quality improvement projects is to always come back to the mission and the outcome. If things start to get confusing, if you're really not sure what you're doing, always go back to what is my mission statement? How is this relevant? And what am I trying to accomplish? The second cartoon, so I'm kind of going like zigzag. So here's number one, here's the second one. So the second cartoon on the right-hand side is really bringing up the idea of buy-in. So when you're making changes, you need to make sure you have commitment from everyone involved. You can't make meaningful changes if no one believes in what you're doing. And you gain support for quality improvement projects when stakeholders believe in the change. The way you do that is by investing in projects that stakeholders feel are relevant and will positively affect them. So here we see that Dilbert's boss says we're hiring a director of change management to help employees embrace strategic changes. And Dilbert says, or we could come up with strategies that make sense when then employees would embrace change. And Dilbert's boss says, that sounds hard, right? So and this can be difficult, right? Getting buy-in can be really difficult to accomplish because not everyone has the same goals all the time, which brings us to the third cartoon. So here's the third cartoon on the left-hand side. Actually don't know what that guy's name is, but the guy in the middle says, our goal is to ship 1 million units this quarter. And Dilbert says, do we have any goals that involve making customers happy? And the guy in the middle says, I'm talking about our goals, not their goals. And Dilbert's boss says, totally different, right? So sometimes the goals of various people or entities are different. And sometimes they're even in conflict. So again, it's really important when you're looking at quality improvement to come back to mission and outcomes, because you can get lost in the weeds when you get caught up in goals that are mired in self-interest. Sometimes it's hard to see the ways in which stakeholders have an investment in service in certain projects being accomplished, or even in certain projects not getting done. And then this last cartoon on the bottom, I just love. So Gilbert's boss says, my new style of management is exhausting me. I heard some people talking about MBWA, or management by walking around. I walked all the way to the park and back, but I can't say that I see much improvement around here. So one of the best ways to figure out what's going on with a process is direct observation. Obviously, once you do your observation, the next step is to figure out where the process can be improved from an objective standpoint. And sometimes when we're so focused on just getting the job done, we aren't always able to see the process objectively, right? So when you're in the project, when you're doing the process, um, it's really hard to be objective. And so what a manager might do is from an objective standpoint, sort of stand and observe what the worker is doing, right? And then they might see things that the worker can't see because they're inside the project. So essentially, to improve quality, you need to research the problem, but change won't happen without action. So quality improvement. Um, when I think about quality improvement, I think about these three words. The first is systematic. Quality improvement happens systematically. There are steps to the process. You don't just choose a thing to work on it and say, look, I've improved the quality, right? You need to have um, a few different elements. And we're going to talk about what that is, but what those are. But the main element is data. And that's actually our next slide. So, but really what you're going to do is you need to have a process for improving processes. Another thing I think about is standardization. So when we do quality improvement, if we find something that works, we try to replicate or standardize across similar areas. And then the last thing is outcomes. Um, Especially with social work, um, a lot of times the focus can really be on services. What services are we providing? And what quality improvement seeks to do is really look at outcomes. What are we trying to accomplish? And how are people's lives improving? So when I think about quality improvement, these are the things that I think about. So as I mentioned, quality improvement is highly dependent on data. So what is data? Data is information, right? And so in order to understand what a quality improvement process should look like, we need to start with data. So there's different kinds of data. So primary data is data that a researcher collects, right? It's something that you learn firsthand. And we'll talk about how to collect data in a little while. Secondary data is data that previously existed and the researcher analyzes. Qualitative data is using words and ideas to frame the information. So a qualitative example might be that somebody tells you their experience. That's information, right? I had a really positive experience when I went to the grocery store, and all of the fruit was really fresh, and I didn't have to look for anything. Like it was all out and ready to be picked. And then I went to the register, and the cashier smiled at me and was really efficient at checking me out, right? So like that's data. We learned information about the trip to the grocery store. Quantitative is using numbers and measurement. So quantitative data, an example might be 45 people walked into the grocery store between the hours of 12 and 1 o'clock on their lunch break, or during the lunch hour. And out of those 45 people, 39 people used the self-checkout. Okay, so like that might be quantitative data. um, Research ethics. So when you're doing research with human subjects, ensuring that you do no harm and getting informed consent is important. So you want to make sure people, if they're participating in your collection, your data collection project, are aware of what's happening, and that you are and that you're getting their consent to work with them, and also that you're making sure that whatever your research topic is, that you're not doing anything that could be harmful to the participant. So that's what I want to say about data. So we're going to talk about research methods and tools now that we understand a little bit more about what data is. So there's a few different kinds of quality improvement projects that you can do, and actually there's more than what's here. But these are the most common that you might hear talked about. So total quality management is a method of quality improvement that involves all employees or all stakeholders, making sure that they are all committed, that they're all involved in continuous improvement with a particular focus on a customer experience. Lean or Six Sigma, those are actually different things, but they're often kind of grouped together, because they both focus on obtaining the fastest change possible through specific projects. Um, I don't know if you ever heard of like Six Sigma belts. They kind of do belt levels like in karate. So you can be like a really like you can be like on the lower end or the higher end. And sort of lean project management is I want to say it's like the gateway to Six Sigma. You kind of start out doing lean, which I really love doing lean quality improvement projects. And I do them at home all the time, and probably you do too, and you don't even know it. Lean is about looking at a process and figuring out where you can cut the fat, right? Like cut excess out of the project to make it more efficient. And then continuous quality improvement focuses on progressive, incremental improvement of processes to improve outcomes. This is the most common framework used in social service organizations, and the most common tool used is the PDSA or the PDCA cycle. So PDSA stands for Plan, Do, Study, Act. The C, if you were to do a PDCA instead of PDSA, it's exactly the same thing, but it's Plan, Do, Check, Act. So I do have a video. Let me just reshare real quick to make sure I'm optimizing for video. Okay. Let me know if you can't see it, but hopefully you can again. Let me know if you can't hear it, but hopefully now you can. So I'm going to share this video. It's a little bit longer. I'm going to cut it short to about 3 minutes. But this will help you understand what a PDSA cycle is. And like I said, it's the most commonly used form of quality improvement, like a framework, most used framework for quality improvement in social work usually, and health services as well.
I'm going to talk to you about the Deming cycle, or a PDSA. That stands for Plan, Do, Study, Act. And it's a very simple means of continuous improvement that's been in place for a really long time, since the 1950s. And it's been used for that long because it's very, very effective. It's based on the scientific method, and it's pretty simple, and it's just a way of making sure that we're continuously improving and taking steps to reach our goals. So the first step is to plan. We're going to first identify a problem, an area of weakness, or just something that we want to improve upon and start using in our classroom. So this may be something that you know you need to improve on for your evaluation, or you just know that you need to learn about a certain piece of technology and start using it with your students because it's going to benefit them. Whatever it is that you need to work on. So we're going to write a SMART improvement goal for that problem. Now, a SMART goal is a whole nother, lesson of professional development, but basically it's something that needs to be very specific and measurable. So you want to think about what data you could draw on to see if you're meeting your goal or not. And it needs something that can be realistically achieved in a timely manner. So we're going to write that goal, and then we're going to make a list of what we need to do to be able to reach that goal. So what are some strategies we can put in place to help us accomplish that? And once we've done our planning, we're going to actually put some things into action. So you can see with the PDSA, you plan something and then you just try it, and then we'll evaluate later if it worked or not and what we need to do better. So we may need to complete some training, like learning how to use a piece of technology or learning what differentiated instruction really is. We may need to educate ourselves a little bit. We're going to make our preparations, and then we're going to implement some changes. We're going to follow those strategies that we put into place. Once we've tried it out, we're going to decide if it was effective or not. So we're going to study our results. We want to look at some data and see if our strategy has seemed to be effective or not. And then finally, we're going to act. If we have achieved our goal already, which is unlikely on the first time around the cycle, but if we've achieved our goal, then we need to just take steps to make those improvements permanent, and then we can begin a new goal and an entirely new PDSA cycle. But more than likely, we won't have actually met our goal yet. We'll see areas where we can improve, and we will want to go back to the plan phase and change our strategies a little and start this process over again. And we'll continue around the circle until we have achieved our goal. And it's okay to go around the circle many, many times in your attempt to achieve that goal, as long as you're always making continuous improvement and progress. So
Okay, so you can see this sort of, the cycle, the PDSA cycle. You see why it's a cycle. You can also see why we call it continuous quality improvement. You really never stop. And what that does sometimes is exhausts you. So one of my earlier slides, I had a bunch of cartoons that showed some of the concerns that people have about quality improvement. But what I didn't share is that it can be really tiring sometimes to be constantly trying to figure out what you need to do to improve outcomes, and you're sometimes moving the needle really slowly. And I know we've talked about in this group before in the past trainings a little bit about um, the sort of the slow rate at which committee work moves. And this is one of those reasons, because we are doing slow incremental change for the most part.
let's take
So let's talk about methods of data collection. We talked about sort of qualitative versus quantitative earlier. What I don't have on here is ways to collect quantitative data so much, which could be experiments, right? Like actual research projects where you gather statistics and things like that. But also we do have data systems where we collect data and then review reporting. So an example of this for the COC might be system performance metrics, point in time, excuse me, count data, things like that. Data that usually we get off of HMIS as well. But other methods of data collection could include surveys. So for instance, if you are at the program level and you are a client in a program, you may have received a satisfaction survey. How are we doing? Right? You may have received a specific survey. So sometimes agencies will distribute surveys regularly, and sometimes they'll ask you very specific survey questions if they want to learn, they want data on a specific issue. Focus groups are small groups of people who are asked a very specific question or short, maybe 2 to 3 questions. Focus groups are not being asked 10 questions. It might be just 1 to 3 questions, again, on a really specific topic. And in a focus group, you get sometimes different information than you might get in a survey, because somebody might say something in a focus group that another person says, oh, yeah, I agree. That's happened to me too. I wasn't thinking about that. And then all of a sudden you have compounded data that you might not get in a survey. Key informant interviews is when you have a very, you'd have more questions again than a survey, right? You'd have more questions. And these interviews would be conducted by a researcher with a person or a entity that has specific expertise on a project. Observation, we talked about observation when I was sharing the cartoons earlier. The observation is when you literally go and see what's happening. So this happens a lot with like supply chain issues, right? So like maybe, or like in a factory, and like Lean Six Sigma has something called a go see, like literally go and see what's happening. In a go see, somebody might go and watch in the factory, like the line, to see where a process is getting held up. But we might do it in other ways too. As a supervisor, I often, a few times a year for each of my team members, will sit in on their sessions, and just observe, how do they do their session, how are they conducting their session, how are they communicating with their clients or their patients, they're doing their education, are they completing their forms correctly, things like that. So those are an example of observation. And then we talked about experiments sort of towards the beginning of the slide. I went a little backwards. So planning tools, I actually don't love the way that I laid this slide out, because we're going to start on the right where it says SWOT analysis, because when SWOT analysis is the tool that you use to help you plan out your goals, but not necessarily to plan out, like to plan out what your goals are, not necessarily how you're going to achieve your goals. So we're going to start with the SWOT, because the other two are about how to achieve the goals. I got the SWOT chart from Wikipedia. It's like not hard to find different SWOT analyses, but I didn't want too much information for the purposes of this. It just sort of like very, very broadly. The strength section. So basically what you do is you split your paper, or, whatever, you don't have to split it this way, but you split it into sort of quadrants. And the strengths are characteristics that give you an advantage. The weaknesses are characteristics that place you at a disadvantage. And so normally strengths and weaknesses are things that you identify that are happening within your system, or within your whatever system it is that you're looking at. So it might be an organization, or a company. It might be your home. It might be your committee, or in our case, our system, our homeless planning system. So when we were creating our strategic plan, we did a SWOT analysis. And we looked at strengths and weaknesses internal to our system. Opportunities are elements in the environment that you can use to your advantage, and threats are elements in the environment that leave you vulnerable. So opportunities and threats are more what can you not control necessarily. There are things outside of your organization that you can't control as much. So what you would do is you would do a SWOT analysis. You could do a SWOT analysis. It's one option that you have available to you when you're trying to do your research, to do your plan stage of your PDSA, right? So that would be, you would do that first. In addition to gathering other data. So SWOT analysis is a way of just gathering data. So then on the left, you have SMART goals. So this SMART goals comes from Columbia, and it gives some good example. So I know that we've reviewed SMART goals before in prior trainings, but this is a nice little kind of worksheet that goes a little bit into some details and examples. So when you're doing your planning, you might want to do a SMART goal. So SMART, it means specific, measurable, attainable, relevant, and time bound. So you want to know what is the goal, and you want to be really clear on, like, again, quantifying is really, really helpful when you're trying to determine goals, because those are measurable. Quantifiable goals are measurable. So in this case, I want to cut the 6 hours I spend processing data in Excel every day to 3 hours by implementing an improved work routine, right? How will I measure my progress? So when you are doing your SMART goal, you want to determine what your evaluation method will be. How am I measuring this? Attainable. Do you have the skills and the resources for this? And if you don't, you may want to create a barriers list that reviews the barriers to the SMART goal. And you also might want to list your resources as well. What do you have available to you? Relevant, why is this goal important? How is this connected to the mission? And time bound, when will I achieve the goal that I set? The middle is a logic model. So this I took off of the CDC. I've actually used this CDC guide before when writing my own grants, because we often have to do logic models when we are writing grants to demonstrate what our outcomes will be. So logic model is a little more complicated. The SMART goal is format is a little more broad. The logic model gets into the nitty gritty details of how are you going to do this thing. So in the logic model, inputs are resources, right? So I mentioned you might want to list out your resources. This is one way that you can do it, is by using the logic model. Activities are the specific events and strategies that you're going to use. Outputs is the product of the activities. Okay, so here we have an example, and I do STI testing and treatment in my clinic. So this is why I've used this logic model samples before, but examples might be your funding, staff, materials. For activities, an example might be patient testing and treatment, staff training. Outputs might be the number of people you've treated. So again, notice output is a number, right? It's not an outcome. It doesn't say whether or not those patients felt good about their treatment, felt like they received good education, right? Like those would be outcomes, right? And so you might have short-term outcomes, in medium length outcomes, and long-term outcomes. And also, what's not included in this screenshot here are your evaluation methods. So again, evaluating your processes and evaluating your outcomes. How are you going to determine what that looks like? So when you're doing evaluation and monitoring, these are really important parts of the PDSA cycle. So often we implement projects, quality improvement projects, and we don't kind of check up on them to see if they're working. We're just sort of doing them. We're like, oh, this is going to improve quality, and we just do it without really, we set our outcome, and without really, really looking to see if these activities are effective. So you want to use measurements. I often find that looking at charts is really helpful. So like before the project, we were here, and this bar chart, this bar graph shows this. And after the project, we were here, and now we can really see, did we really improve, and what does that improvement look like? And evaluation, really, it's not just looking at the data, it's also making a judgment about the data. Okay, so remember that last step of the PDSA cycle, the ACT step is, okay, either this didn't work and I'm going to start a new PDSA cycle, or this did work and now we're going to codify this. We're going to make this a long-lasting process, and we're going to standardize, and we're going to move that forward. And monitoring means that, okay, so now you have a new process. You got to observe it over time and you have to review it systematically. And what that looks like might be different depending on what your project goals and outcomes are. So now let's talk about the consumer role in all of this, right? So it's like all this information, okay, quality improvement, I get it, but like, and you might even get why. Okay, I understand we need to do quality improvement because it's going to improve the outcomes of people in our homeless system. And when we think about those outcomes, really what we're looking at is those system performance metrics. We want to reduce the length of homelessness. We want to reduce the number of people that are homeless, and especially for first time homeless. We want to reduce. We want to increase the amount of people who are connected to resources, income, and uh, income and other resources. We want to increase the amount of people who are connected to permanent housing. We want to reduce the amount of people who are coming back into our system and becoming homeless again, returning back into homeless, right? So these are outcomes that are really, really valuable, and I think that most people can get behind them. So now you've talked about all this. What is the consumer role? So the first thing we have to do is talk about what is a consumer. Because this language sometimes can get a little dicey. Not everybody likes to be called a consumer, and some people don't mind, but then they don't really get, what it really means. And so, what is a consumer when we use this language? What are we talking about? At its basic level, a consumer is a service user. It's somebody who consumes services. Remember before I kind of mentioned sort of this difference between talking about services and talking about outcomes. For instance, I could tell you all the services that I offer in my program, um, which is easier to understand. And it's certainly something that people want to fund, right? And people want to talk about. Look at all this stuff you do. You do so much stuff. Okay, right. But how are you changing lives is the outcome focused part of it. But at the end of the day, consumer is somebody who uses services. We might call them a client. We might call them a patient, a guest, a customer. We might call them a person with experience. A person with experience, so I work with people with HIV. So it might be a person with experience of having HIV. It might be somebody who I work with the LGBT population. So it might be a person with experience of a person with transgender experience, right? So you might have different kinds of experience. In this case, for this group, it is people with lived experience of homelessness and housing crisis. So when we talk about consumer, that's what we're talking about, is that group of people, right? People who have been through the system. Why should consumers be involved in quality projects? So providing a consumer perspective on major strategic decisions is imperative to making sure that we, as uh, service providers, almost forgot, like, can't remember what we are, that as service providers, we are meeting the needs in terms of our overall vision. So on that top level, major strategic decisions, what is our mission, and making sure that it's still relevant to the people we serve. Consumers can give feedback that is unique. Providers can talk about how services are experienced from their end, right? Like what their experience of providing services is, but only consumers can give feedback on how they experience services being delivered. And consumers can raise issues of concern that are, again, very unique. So it's really important for consumers to be involved in the process of figuring out what's broken and how can we fix it. And sometimes things aren't broken. Sometimes they just need a little tweaking. What can be done better? What would improve the experience? Only consumers can tell us that answer. So sorry, strange technical issue, but I think it's better now. So how do we avoid something that's called tokenism, right? Just choosing a consumer and saying, "Can you come to tell us stuff?" and just sort of putting them on a board, or having them do a survey, or having them do um, a focus group, and it's not meaningful, right? So we want to have meaningful consumer voice, and so uh, here are different ways that we can do that. So the first way is to make sure we're involving consumers in care planning. So this is a really individualized notion of consumer involvement, is to look at their own personal plan. Sometimes they're called service plans. We call them health plans where I work because I'm in healthcare. But they're the care that they're receiving, right? Like, what are their goals, right? What is the consumer's goal? Um, and what are their resources, right? And really making sure that the consumer has choice and voice when they're in, and that they're involved in their own care plan. Not that it's being imposed on them by somebody who thinks they know better. Um, uh, Other ways is to give consumers opportunities for active in-person interaction with decision makers, making sure that the people who are making decisions have I would say almost opposite, that the people who are decision makers have the opportunity to hear the voices of consumers and to use those voices, right? Use it as data. This is information that I can now use to make a decision. Um, we should be giving consumers multiple ways to engage. So what that means is, um, we talked about the different types of data, right? Doing surveys, doing focus groups, also being on boards, which brings me to the next bullet point, which is that making sure pathways are available so that consumers can participate in increasingly active roles. So that might include, for instance, and this is one of the strategic plan goals for the COC right now. We say creating pathways, having dedicated spots on different committees, and kind of having like increasing, giving consumers increasing responsibility, in not just, oh, not sure what happened there. Somebody wrote on my screen. Um, I actually lost my train of thought after that happened. That not only are we giving people the opportunity to try different committees, that have increasingly, um, a higher degree of responsibility, and decision making, but also that people are given the opportunity to maybe move into leadership roles, right? Making sure that people are included at the highest levels of governance, again, where decisions are happening. Um, that we are making sure that we're recruiting consumer representatives of diverse populations, right? So having a consumer board, or having consumers on various boards is really, really good. But if everybody is a white man, that doesn't help us, right? And the same with any population. If they were all um, uh, Portuguese women, you're right, like that's still not diversity, right? So unless you were, your organization was very specifically outreaching to Portuguese women, and in which case that would be entirely appropriate. But if you have a diverse population that you're serving, you want to make sure that you are recruiting those diverse populations into the various levels. Making sure that there's dedicated resources. And so an example of that might be meeting facilities, administrative support, sometimes food, transportation, right? Not everybody can always get everywhere all the time. Having virtual meetings has created more accessibility for most people, but there are people who still cannot access, meeting softwares and things like that, don't have a smartphone, or they don't have Wi-Fi, whatever else. Having training and support, and again, dedicated resources. And then lastly, that we're addressing barriers to having a meaningful consumer voice experience, right? Um, so that if transportation's an issue, that we are figuring that out. We're figuring it out together. So, in conclusion, um, continuous improvement of the homeless system. Sorry, I left out a word there. Continuous improvement of the homeless system in Morris County is a primary goal of the COC. By understanding the research and planning process, particularly as it relates to quality improvement projects, committee members will be able to better participate in this work. Consumers have a vital and unique role in improving the quality of services overall and key outcomes more specifically. So I thank you. That ends. Oh, somebody waiting in the waiting room. That ends today's training. I thank you so much for your attention.